Good evening, everyone. Good afternoon. Welcome
Mhm.
to the Functional Solutions podcast brought to you by the American Academy of Functional Health. I'm Dr. Sarah, and I'm joined by my amazing co host, Dr. Chill. How are you today,
Yay.
Chill?
I'm doing great. How are you doing, Dr. Sarah? It's good to see you again.
Good to see you too. I'm doing good. It's been a good and busy day, productive, but I'm always looking forward to our Wednesday evening chats.
Me as well. Busy and productive, and also looking forward to this.
Yes, yes. Awesome. We're excited to chat with you all today. Let us know down in the comments where you're joining from. I am an East Coaster joining you all from Charleston, South Carolina. Any fun things happened this week? So far, we're in the middle, so in the hump day. But has anything good happened this week?
It's been extremely busy. Lots of great discussions with some students and lots of great coaching sessions with some students. A few of the practitioners are already having some breakthroughs with their
Wonderful.
patients. So that's always awesome to hear about and
Yeah.
learn about, especially when the practitioner is super excited for those breakthroughs for their patients and utilizing all of the functional medicine approaches, and now their
Absolutely.
patients are reaping the benefits of that. It's really cool to see.
That is wonderful. Yes, one of my favorite parts of the way that we support our students and practitioners at the academy is just having that support and coaching and easing you all through the week and through all of the content that we cover.
Absolutely.
And you all know that, here on our show, we do a lot of talking and discussing ways that you can have practical science-based strategies to help elevate your patient care and further advance the field of functional medicine. And so today we are going to be diving into a really, really good topic, probably something I could talk about ad nauseum.
Mhm.
But we are going to be discussing how to integrate mindfulness and stress reducing techniques into patient care. Now, this is a topic that I think is really foundational to health, but oftentimes it can be overlooked because we're so focused on, the clinical workup and making sure that, we're sticking to the standard of care and applying some of the amazing things that we've learned in our functional medicine training. But as we'll talk about today, addressing stress and incorporating mindfulness techniques may be that one little piece that's missing in your treatment plans when it comes to especially complex patients. Dr. Chill, in your practice,
Mhm.
how have you utilized and found a way to integrate mindfulness and stress reducing techniques with your patients?
It's really about giving them small bite-size
Yeah.
techniques. The biggest thing are is we have some of those patients where they're like, I can meditate for 20, 30 minutes a day.
Yes.
But then we have those patients that are like, I've never made it meditated at all, right?
Yes.
So we really have to meet our patients where they're at and provide all of the different resources for where they're at, no matter where they're at,
Yes.
right? So, with the patients who have never meditated before, it's going to be about starting in small steps, right?
Mhm.
Maybe a minute, 2 minute, 5 minute meditation may be really great, or other techniques that may be more beneficial for them because not everybody wants to meditate right away, right? So,
Exactly.
what are some other stress reduction? Mindfulness techniques that you can provide for them as well. It's really about learning how to meet the patient where they're at.
Yes, absolutely. And as we'll cover later on during our time together today, we'll find that, the changes that we see with the mindfulness techniques and the stress reducing techniques, they don't just make us feel good. They actually change our biochemistry. They actually change our physiology. And so we're going to talk more about data that actually shows how it's changed anxiety and depression levels and all of those things.
I love the data.
Exactly, exactly. So, why did we pick this topic? Well, I mean, anyone can tell you with today's climate, I mean, Everyone has at some point in their life has been under stress. And unfortunately, for a variety of different reasons, we are all under quite a bit of stress. And in fact, a one survey by the US Census found that 4 out of 10 American adults report experiencing symptoms of stress, anxiety, and depression. So think about the number of patients you see every day. 4 out of 10 of them are suffering with chronic stress, the impact of chronic stress, and may not actually share that information with you. So when we're reviewing the determinants of health during our intake, it's important to ask them about their stress and have them rated, and then you can begin to incorporate some of the strategies that we'll be talking about later on. So let's take a look at our first figure. This is showing the share of adults that struggle with mental health. Specifically, they were looking at stress, anxiety, and depression during the years 2020 and 2023. We see here that all age groups, 18 to 29, even up to 65 plus, did see a significant level of stress. And unfortunately, over time, from phase one over to phase three, not much of that share has changed. So either in some cases it increased, and in most cases it has stayed the same. So this shows that there are a number of adults who could benefit from learning how to better manage their stress and how to further reduce the symptoms that are associated with stress. And those symptoms can range from headaches, digestive issues, difficulty sleeping, or insomnia, and even burnout. Now, we know that chronic stress is a known driver of inflammation. It can also cause hormonal imbalances and be one of the drivers of metabolic dysfunction. So, when you have patients that are presenting in your practice with type 2 diabetes, autoimmune conditions, hypertension, heart disease, you want to think about the role in which stress and inflammation is playing in the manifestation of those symptoms and those conditions. So, for example, as providers, as functional medicine providers, we really love to focus on root cause medicine. So that means we cannot just ignore the impact that stress has on our patient's overall health. Now, so when a patient is coming in during our intake, we can take a moment to determine whether or not their symptoms are associated with stress and the inflammation caused by stress, and whether or not it's associated with a dysregulation of their HPA axis, that hypothalamus, pituitary, and adrenal gland communication pathway, whether or not stress is depleting key nutrients. That often happens when we are experiencing chronically elevated levels of cortisol, or whether or not stress is exacerbating certain autoimmune conditions. Either way, regardless of how your patient is presenting in your office, it is important to address stress, as it is a key factor in nearly every chronic illness that we see in our office. And as always, you will learn more in our program, the Advanced in Clinical Functional Medicine program. So don't forget to check into your platform and begin to review all of the ways in which stress can impact chronic disease. Now, of course, it wouldn't be our podcast if we didn't have a quiz and asking some questions, getting those brain juices flowing. So, which of the following conditions are associated with or tend to get worse with stress? Number one, irritable bowel syndrome. Number two, anxiety. Number three, all the other answers except number two. Or number four, all of the above answers. We'll give you all a moment. I wish we had some Jeopardy music going on. But this should be a pretty easy one because, I mean, we see so many patients in our office that are under severe amounts of stress. And the answer is All. So, both irritable bowel syndrome and anxiety are associated with or get worse with stress. And these two are actually associated with the gut brain axis. So, it's really interesting to see how when you are stressed, and anxious, you tend to also have some gut issues. You may tend to have excitatory diarrhea. All of those are a reflection of how stress impacts our gut and our brain as well. All right. So, Dr. Chill,
Yes.
how have you seen stress impact, or what conditions in your practice have you seen stress worsen certain symptoms and presentations?
Every single condition. Just like the answer for the quiz, all of the
Yes.
above, the
Yes.
same here in your practice. It's going to be all of the above. This is why in functional medicine, stress is such a major component, and
Yes.
lifestyle and behavior modification is such a major component to our approaches, right? It should always be included in our treatment approaches when we're working with our patients, because stress, cortisol levels, that HPA axis that you were talking about,
Mhm.
it is all included in the improvements for our patients.
Absolutely, absolutely. And when I think about, okay, which populations should I really hammer home,
Mhm.
putting together an effective stress management kit? And I always think about something we learned in medical school. I believe it was in our advanced geriatrics class, where they measured folks' happiness levels.
Mm.
And they felt over time, and they saw that those levels were U-shaped. So from toddlerhood to right around mid 20s, the happiness levels are increased. And then between like mid 20s to like mid 40s, probably late 40s, your happiness levels are a bit lower. Real life is hit, got to pay those student loans back.
That real
Kids,
life gets to you every
yes,
time.
real life gets a hold of you, right? And then as you get older into retirement, your happiness levels kind of go up. And so if we follow that, then we tend to see that usually those busy adults who have families, who are working and really just trying to manage life, those are going to be those patients that you're going to want to make sure they have sufficient stress management support. And then unfortunately in this age, we see a lot of stress with preteens and teens.
Mhm.
So that's another patient population to consider as well.
Absolutely. That's such a good point. And that actually transitions right into the next topic we want to go into, which is the stress impact on our health. As functional medicine practitioners, the great thing that we do is we dive into the whys and the hows with our patients. This is why they love us. And this is why they keep sending us referrals, is because we dive into the reason behind they're having all of their issues. And that's no different with stress. So before we kind of get into all of the different treatment approaches with everyone here, let's go into the whys so you can actually explain this to your patients as well. So we all know that stress has a major impact on every condition, as I just mentioned, right? One of the biggest areas is going to be in inflammation. As functional medicine practitioners, we are inflammation investigators. We're constantly trying to investigate the cause and the root causes of inflammation, right? Stress is going to be a major contributing factor to inflammation. It's a response that activates our nervous system, our endocrine system, our immune system. And we all know that acute stress can be very beneficial, right? It can help us to keep us alert, it can keep us motivated, it can help with the healing process. But the issue comes into play when there is prolonged stress that is not managed properly. This can lead to maladaptive responses, and it can present clinically as depression, anxiety, cognitive impairment, and even things like and conditions such as heart disease, right? Stress can impact every single organ system, and it can have profound effects, especially with the cardiovascular system, also the digestive system, and even reproductive health. So let's pop up an image here and kind of show you the impact of psychological stress, also physical stress, right? Because they both coincide and they both contribute to this cycle of stress. We can see here on the top that it goes into psychological stress. On the bottom is physical stress. And what I really want to point out here are the immunological effects, the behavioral effects, some of the neurochemical effects that is happening, right? This is all within the brain. Look at the immunological effects. We see that it impacts IL-1, IL-6, TNF alpha. Now, what are all those cytokines doing? They are all pro-inflammatory. So that means they're all increasing our inflammatory responses. So this is one of the major reasons as to why stress can be so impactful in our health and can lead to different cardiovascular impacts, reproductive impacts, and also digestive impacts. It's because it is triggering these pro-inflammatory cytokines. This is what you might want to explain with your patients as to why this is happening. Why is stress causing these issues, right? It's because it's causing the pro-inflammatory response. It's triggering these specific pro-inflammatory markers in your patients. And now when we go down the pathway a little bit further, it's going to affect our adrenal glands, which is our cortisol response, which can also help to regulate blood sugar. This is where the metabolism comes into play. And when we go inside this pathway, it can also affect our liver. So if we're in chronic stress states, chronic pro-inflammatory states, our liver isn't functioning as well as it needs to. And what is the liver responsible for, right? It's the cytochrome P450. It is responsible for metabolism. And so if you are not having an optimal liver function, you are not optimized in metabolizing and eliminating properly, right? And so this is going to be really important for your patients as well, especially if you have hormonal issues, if you have environmental toxicants, just like we talked about in last week. Your liver is going to be really, really important in processing all of those toxicants, processing all of those hormones. And if it's not in good repair due to psychological stress or a chronic type of stress situation, then you're not metabolizing and eliminating properly. And so that is one way that you can explain to your patients on how stress is going to be impacting their health, especially from a functional medicine perspective. And that was the image that was published on the American Journal of Psychiatry, and this was in 2000. So 25 years ago, the researchers, they uncovered a profound impact on stress and the cytokine production, as I was mentioning. And we all now know that it is responsible for regulating the inflammation. And you can also see that there's a cross of the blood-brain barrier that's happening, and that can influence both the physical and mental health. And that is all the vicious cycle that we were showing in that image here. Now, why is that important? Because it's that chronic inflammation that we were mentioning earlier. This can lay the foundation for chronic conditions such as atherosclerosis, type 2 diabetes, depression, anxiety, and then many other issues that are there. So this is exactly why integrating things like mindfulness into our treatment approaches as functional medicine practitioners is going to be really essential when you're working with your patients, because addressing stress the HPA axis, those cortisol responses, can really help with regulating inflammatory response. It's going to help with promoting the healing for our patients and really supporting long-term wellness in our patients. And we will be diving into many more approaches with stress and many more approaches with the conditions we just talked about in the advanced and clinical functional medicine program. So don't forget to go into the program, start going into all of, you can even type in stress or cortisol in the search button, and all the modules that are associated with it will pop up, and you can start to learn about all of the biomechanics, the physiology, the treatment approaches, all of the different labs that you might want to consider for these types of patients. Now we're going to bring it back to Dr. Sarah, and she's going to talk about the endocrine system and the impact of stress.
Wonderful. I'm so glad that you highlighted, kind of brought us back to our cytokines and
Mm,
immunology, really to just highlight the importance and the big role that inflammation plays on so many different disease processes. I think it's a phenomenon that probably folks are tired of us saying it's inflammation, but it really is that root cause that we have to address.
absolutely. It's the one of the biggest root causes and contributing
Exactly.
factors.
Yeah, yeah, trying to kind of quench that flame rather than continuing to do and expose our patients to things that only further exacerbate inflammation.
You're absolutely
And,
right.
modulating our and supporting a healthy inflammatory response is so important, particularly when it comes to metabolic health and like our endocrine health. Now, when we think of endocrine health, usually the first things that pop up in our minds are, thyroid hormones, reproductive hormones, but we can't forget about our metabolic hormones, not just GLP-1s, but also insulin and so many other hormones that play a role in our metabolism, in the way in which we produce energy for our bodies. So let's take a look at an image from a 2022 study in the Journal of Neurochemical Research. Now, this was a really interesting study because it aimed to explore the relationship between visceral adiposity and obesity, so having more fat gain around those internal organs, and the risk of developing chronic diseases like Alzheimer's. Now, I chose this image because this is more of like the downstream effects of not providing a patient with a comprehensive stress management kit of sorts. Because if someone is under chronic stress, they are going to crave certain foods. So when we are under stress, we tend to crave high foods that are high in sugar, high in fat, and high in salt. So we can see here in the top right, folks who are under chronic stress, high amounts of stress, they tend to be more likely to consume high fat foods or that standard American diet food. Having high fat foods leads to obesity. Now, obesity in and of itself places us in an inflammatory position and inflammatory conditions. And so our body is going to, or your patient's bodies are going to be releasing even more of those pro-inflammatory cytokines that Dr. Chill explained and talked about earlier. Now, these messaging chemicals are going to lead to endothelial adhesion molecules. So these are molecules on the surface of your patient's vasculature and their blood vessels. And it is going to cause more fat, more calcium to adhere to the surfaces of that blood vessel. That is going to increase their risk of cardiovascular disease. And further, the immune system and immune cells are going to begin to infiltrate that space, further driving up that inflammatory process. And as you can see with that arrow, that just continuously fans the flames of inflammation by turning on those pro-inflammatory markers, but also pro-atherogenic markers and mediators. So this inflammatory process doesn't just upregulate our immune system, but it also creates an environment that supports the hardening of our blood vessels and development of heart disease, rather than facilitating and supporting a healthy cardiovascular system. And this inflammatory state doesn't just cause and lead to heart disease, but it also sets us up and our patients up for insulin resistance, developing insulin resistance. So, by providing your patient with more options on how to reduce their stress and manage their stress, we can kind of block off this whole process by supporting good nutritional habits, reducing their obesity and their weight, and thus reducing the inflammatory cytokines that they are likely producing. Now, this is important because, as we know, stress induces visceral fat. Visceral fat increases inflammation, and that can cause metabolic changes that sets the foundation for type 2 diabetes, Alzheimer's disease, and other neurodegenerative diseases, as well as hypertension. Now, if you want to learn more about integrative approaches to weight management and treatment strategies, please head to our platform and log in and choose the Functional Weight Loss Certification Program. So, I wanted to take a moment to discuss the fact that GLP-1 agonists, which have been, so popular lately. Let's talk about some of the ways that we know why it's been so beneficial, not just for weight loss, but for cholesterol levels and blood pressure. And when I looked through some of the research, many researchers highlighted the fact that GLP-1 peptides also reduce inflammation, and they drive up the anti-inflammatory cytokines while decreasing the pro-inflammatory cytokines.
Absolutely. And what's great is you mentioned the weight loss program, right? We
Mhm.
dive into the GLP-1 agonists, but we go even further than that, right? Because it's not just about giving a supplement or a pill, right? And you mentioned this in that image. One of the biggest things with insulin resistance is the diet, right? And
Yeah.
this is the root issue. This is the main root issue. What's funny is I was just talking with a PA who just joined our program, and he has been in diabetes management for over 20 years.
Wow.
And he came to our program because he was tired of constantly prescribing and managing diabetes with prescriptions, and his patients never got better.
Right.
Right. And he was like, all I'm doing is managing their prescriptions and they're still not getting better. They're still eating the same way. So I wanted to give them and provide them functional medicine approaches as well, because we now want to get to the root cause and actually help them.
Yeah.
Right. And so that's another part of the conversation with GLP-1 that we have in the program, is that we're not just talking about different supplementation that we can do. We're going through how can we actually trigger this in the microbiome, because this is where it
Yes.
stems from, right? And so to kind of learn more about that, definitely look into that functional weight loss certification program, because we're going to dive into that even further for you.
Oh, that's so exciting. Awesome.
Yes. So now let's go back to the topic here, right? The mindfulness and stress reduction techniques,
Yes.
and a little bit more about the reasoning behind the prescription of this, or the recommendation of these techniques for our patients, right? So there's many studies that are done on mindfulness based stress reduction therapy. What is that exactly, right? This is meditation therapy. It was originally designed for stress management. Today, it is being used for treating a variety of illnesses such as depression, anxiety, chronic pain, cancer, diabetes, hypertension, skin, and even immune disorders. Let's take a look at an image. It was a study done in 2022, and this was actually featured in the American Heart Association journal. What they did with this study was it was actually a meta-analysis. Within this meta-analysis, it doesn't mention this here, but what they took was they looked at over, I think it was 1,142 studies, and only 12 met the criteria. What they found within these 12 studies was the participants who did mindfulness based stress reduction techniques. What they found was that anyone who had high blood pressure, this equated to 130 over 80 and above. What they found was that when they incorporated mindfulness based stress reduction therapy in their office setting, that their blood pressure, both systolic and diastolic, decreased for them. And then what they also found was that they had a reduction in stress levels and also mood symptoms. So this is one of the reasons why this is often recommended for our patients, especially with high blood pressure, or if they're trying to cope with depression or have a lot of anxiety symptoms, or if they have a lot of chronic stress issues, right? This is one of the reasons, these are one of the techniques that we want to incorporate for within their treatment approach with them. Dr. Sarah is going to go into the other resources and other techniques that you can look into as well, but this is going to be one technique that you can incorporate with your patients. Now, I want to bring up another image that was done in the frontier of psychology, and this was done actually really recently in 2024. This study explores the long-term impact of mindfulness-based stress reduction program, and they analyze participants experiencing at 3 months, 1 year, and 3 years post-completion. The findings are showing that MBSR, that's the mindfulness based reduction program, it provided immediate stress relief, it fostered emotional resilience, it enhanced overall well-being, and then its sustainability depended upon continued practice. So this is where we come into play as functional medicine practitioners, right? Is giving them different approaches for these mindfulness based stress reduction and within this program, right? Within the follow-ups with them, we're asking them how they're doing with all of these techniques, how they're feeling with all of that, and continuing to monitor and then continuing to adjust those techniques that we give to them, because that sustainability really depends on the continued practice. So if we're bringing these practices up in our follow-ups with our patients, then they tend to do these and stay on these practices more so. And it really shows on here the significant long-term benefits that are happening with maintaining those mindfulness practices, because it does have that long-lasting impact with the mindful lifestyle, extending compassion and kindness, and then continue with the personal growth. And if you want to read a little bit more about that, you can find it in what's called the Impact of Mindfulness-Based Stress Reduction Program. And this is a thematic analysis. And again, this was in the Frontiers Journal of Psychology in 2024. And we talked a little bit about this earlier, right? When you are working with patients, you're going to be having a plethora of different types of patients and where they're at with their mindfulness understanding and their meditation understanding. A good recommendation is to start slowly, and then to have them build up their meditation duration over time. So it's okay to start even with 1 to 5 minutes. I have told my patients, where they haven't done any type of meditation, where if they're in the car, what they can even do is just look at the car in front of them and just state, that's a car. And that's all you need to do. And if you're doing that throughout driving through traffic, being like, that's a car, that's a car, it just keeps you within that state of mind. And just doing that simple technique kind of gets you in out of that stress mode when you are in traffic. Or let's say you are going for a walk. Then what you want to do is maybe just concentrate on your walk and your stride while you are walking. Obviously, your mind will come into play, but if you start to constantly go back to focusing on your stride and your walk, and just do that for 1 to 5 minutes, and then you can prolong that mindfulness as you start to go longer, and then you can start to incorporate different meditation techniques as well. But you can start as easy as just stating, that's a car, or looking at, let me concentrate on my stride, and that's it. Just trying to keep it as simple as possible for your patients. Now we are going to talk about another type of technique that you can use for helping your patients with reducing their stress.
Yes. So, honestly, I'm so glad that you talked about, it's okay starting out with 1 to 5 minutes.
Mhm.
I'm sure, those of you watching, that your patients will tell you, oh, I can't meditate. My
Right.
thoughts are always going a mile a minute, and that's okay. Mindfulness is just being present and
Mhm.
acknowledging the fact that, yes, this thought came and that one. And keeping it simple is always the easiest thing or the best thing. So thank you for that reminder.
Absolutely. Mhm.
I am so excited to chat with you all about biofeedback. So let's take a look at this image to kind of help explain what biofeedback is. Biofeedback is a way to change some of the physiological functions in our body by getting feedback from our own body. So, for example, you can use a sensor that measures your respiration as well as your heart rate. And by visualizing those waves that represent your respiration rate and your heart rate, you receive those signals, and then you're able to um, be able to change your respiration rate and your heart rate based on the feedback that you're receiving from your own body. It's a way to bring in more self awareness to bodily functions and show that you actually can control certain functions with intention and by receiving certain feedback and signals from your own body. Now, there are a variety of ways to conduct biofeedback. The studies that I will be showing you today, or one study that we'll be discussing today, really looked at heart rate variability in biofeedback specifically. So let's take a look at some data from a 2015 study. I chose this study, even though it was a small sample size. It was a sample of 60 graduate students. These were nursing students in their School of Public Health. And I thought, what better group of folks to test the impact and efficacy of biofeedback than students, nursing students, whether it's nursing students, medical students. I'm sure we all can recall the stress of going through our medical training, and so if biofeedback can help stressed out students, just think about what it can do for our patients. So these were nurses that were randomly assigned to either the control group or the biofeedback intervention group. The program lasted about 4 weeks, and essentially they wanted to measure their levels of stress, anxiety, and depression over the 4 weeks and comparing the control group to the biofeedback group. This first image shows the pre intervention score for stress, the perceived stress scale. The red bar is their score before the biofeedback or control. And then the pink bar is their score after. And we can see that the control group really didn't see much of a change. Their stress scale pretty much remained the same across those 4 weeks. But the biofeedback group actually saw a reduction from 14.4 to 12.6. When they took a look at how biofeedback impacted anxiety scores, if we look at the next image, we're able to see that that dark green bar is the pre-intervention score before biofeedback, and that light green bar is the score after biofeedback. And we can see quite a reduction as well. And excuse me if you hear my dog barking in the background. But when we looked at their state anxiety scale, we saw that the biofeedback group did see a reduction from 19.9 to 14.4. So biofeedback helped reduce their anxiety scores. And then when they looked at the control group actually had a modest increase in their anxiety scale. So not having any intervention showed an increase in their anxiety compared to just using biofeedback. And then on the last image, they took a scale and measured their depression scores. And when they compared the depression scores before and after biofeedback, there was a decent reduction from 12 to just under 10. So those students did see a significant or important reduction in their depression scores. And then the group that was the control group that did not receive any intervention actually saw an increase in their depression scores. So when it comes to supporting healthy stress and anxiety and depression levels in nursing students, this study showed that biofeedback and heart rate variability biofeedback was effective in reducing their stress levels, reducing their anxiety scores, as well as their depression scores as well. And it's also important to note that without any intervention, the students in the control group, their symptoms got worse. So it's important to lead and tell our patients that the option of not addressing their stress is not going to make the problem go away. And unfortunately, it often leads to worsening symptoms. And so there's never a bad time to address their stress levels. And hopefully this quiz doesn't bring you all too much stress, but let's end our night before we start talking about treatment strategies. We have one more quiz for you all. All right, what are some common signs of chronic stress in patients? Let's think about this. So we have 7 options: aches and pains, insomnia or even sleepiness, a change in social behavior, um, low energy, unfocused or cloudy thinking, all of the answers above, or only the answers that are odd numbers. I'll give you a moment to put your answers in the chat. But what are some common things that your patient may present with that should clue you into chronic stress? All right, so the answer is number 6, all of the above. So the first 5 options are all common signs of chronic stress. And you notice that some of them are opposite of each other. So a patient may be struggling with falling asleep or constantly tired and low energy. Both of which are signs of chronic stress. All right. So if you're a patient, if you can think of patients that present with these symptoms, let's talk about some things that you can do to integrate mindfulness and stress reduction into your practice and into your patient care. Remember, we are thinking about this in the way of, building up your toolbox. So, what are some things we want to put in your toolbox to help support stress management and mindfulness? Number one, I love apps simply because patients, they're right there on their phone. I mean, we have our phones all the time. And so the first app that I like to recommend is Calm. Another app is Headspace, pretty similar. But I love Calm because you actually get a pretty decent free trial. I think you can start with like a 14-day free trial. It is amazing. The Daily Calm, they have a new meditation every day, as well as meditations for different events. So whether it's stress, pre-meeting, anxiety, all of those things. But the thing that separates Calm the most is they have breathing timers. And so we know that diaphragmatic breathing is so important. And so it actually walks you through how to do those deep breathing to support stress management. And so it walks your patient through how to inhale, how to exhale, and you can choose the duration of your meditations. You can do one as short as 1 minute or as long as 30 minutes or 45 minutes. You can choose guided or unguided. And like I said, you get a very decent free trial. And then I believe the monthly subscription rate is $15 a month. And the annual subscription rate is 69. And I have to tell you, that's probably the best 69 bucks I've spent because I use this app every day, all day to help manage stress. And then I recommend it to patients as well. All right. The next app is Breathe Plus. Now, actually, this is a great reminder for me to kind of backtrack a little bit, talking about biofeedback. If you want to incorporate biofeedback into your practice, or you feel like that's a tool that you have some patients in your mind and you think that they could benefit from, you want to search for biofeedback certifications. We'll have the information in the notes for you, but they have a directory that has all of the practitioners that have been certified in biofeedback. You can look for practitioners in your local area and potentially use them as referral partners. So that's how you can find someone who is certified and trained in biofeedback. Biofeedback and neurofeedback are can be pretty complex tools, and you want to make sure you're using a provider who has been sufficiently trained. And having said that, Breathe Plus is an app that I used during my biofeedback training. It was introduced during my biofeedback training, and it is an app on your phone that is free, and it has diaphragmatic breathing timers. So once you've been able to teach your patients the proper way to breathe, and I'm mentioning diaphragmatic breathing because that's one of the main ways that we use heart rate variability biofeedback through breathing to help regulate heart rate and blood pressure. And so the Breathe Plus app, you can set different rates and time duration. So you can tell your patient, hey, download this app, and I want you to set it to a count of 4 inhalation and a count of 6 inhalation. And I want you to do it for 5 minutes. The app will have it preset. It has a very nice kind of relaxing sort of chime to help guide patients through the inhalation and exhalation. So if your patients need something to help to cue them into breathing and support their diaphragmatic breathing practice, the Breathe Plus app is wonderful and it is free. So it's available for iPhones and Androids as well. And same for the Calm app. And then lastly, I wanted to mention another resource, the Nike Fitness Club. I want to make sure I got that name correctly. Yes, it is the Nike Training Club, excuse me. And I mentioned this because exercise, we didn't touch on it too much tonight, but exercise is such an important part of your stress management toolkit. You should absolutely, if safely, if your patients, if exercise is not contraindicated with their condition, you do want to encourage some sort of physical activity. We know how beneficial it is for stress management as well as for anxiety and mindfulness as well. So, the Nike Fitness Club or Nike Training Club is a free app. It has so many different workouts. They also have meditations in there, yoga exercises, different adjustments for accessibility. So if you have patients that are disabled or need different accessibility to be able to be physically active, they also have options for that as well. So these are three free and low cost apps that you can recommend to your patients to help encourage mindfulness and meditation, to support biofeedback and diaphragmatic breathing, and try to overcome that obstacle of working out. Perhaps they don't like going to the gym. Well, now the gym is on your phone and they can work out wherever they have their phone with them. So, yes, Dr. Chill, have you used any of these apps or do you have any that you keep on hand?
I absolutely do. I think you can see it on my phone. I have Mind Time on there, and
I
there's
love
probably
it.
6 different apps that are on there. Calm is on there, Breathe Plus is on there. I love
Yep.
Headspace. Headspace is on there. One thing that I've been really getting into is Expand. It's by the Monroe
Ooh.
Institute, and they do binaural beats. And then they have
Ooh.
guided meditations with music that they've research for over 20 years that impacts your neural feedback.
Love
So
it.
that's been really great as well. But I love that you practice what you preach and are on the Calm app as well. And
Obsessed.
this is what I
Yes.
love to do as a functional medicine practitioner is try everything, right?
Yes.
Before I recommend it to my patients. I want to
Exactly.
try it all. I make sure that it is well researched. We kind of do the vetting for our patients because
That's
they're
right.
constantly sending us all of the things that they're like, what about this? What about this? And so we
Yep.
want to make sure that we're vetting all of these products and supplements for our patients as well.
Absolutely. Absolutely. I just downloaded Expand. I cannot wait to get into that.
You'll
I
have
love
to
it.
report back and let me know how you feel and how you
I
like it.
will. I will. I will. To all of our community members in the advanced and clinical functional medicine program, thank you all for joining. If you have not logged into your portal, hop in. As you can tell tonight, we've talked about a number of content and information that is featured in a variety of our modules in the program. So don't forget to log back in, refresh your memory on some of this content. If you are interested in joining the program, please head to the American Academy for Functional Health to join more information. And remember, we also have coaching calls. So when you log into your platform, say you have some questions about the clinical guides, please don't hesitate to book a coaching call with myself or Dr. Chill. We are here to help you and we look forward to supporting you on this journey. Wonderful. I hope you all have a great night and we'll see you next week.
Bye, everybody.
Bye.